Over the past month, there have been several reports of deaths among people who have received the COVID vaccine shot. Here are a few screenshots from the news. In early January, a healthy physician from Florida died about 2 weeks after receiving the COVID vaccine. Then came the report in mid-January that 23 residents at nursing homes in Norway died within days after getting the mRNA vaccines. In early February, a Virginia woman died within 1 day after COVID-19 vaccine shot. Just a few days ago, a man in his 70s collapsed and died 25 minutes after his COVID vaccine shot at Javits Center in New York City. Many older people are waiting for their turns to get the COVID-19 vaccines. Some are worried that the vaccines may cause death or harms in humans. To help people better understand the mRNA vaccines and what to expect after the vaccination, I researched and analyzed the current available data on the safety of the mRNA vaccines. Since the mRNA vaccines are still new to many people, I would like to summarize what they are and how they work. The mRNA in the vaccine codes the spike protein on the surface of the coronavirus. The genome of the COVID-19 virus has close to 30,000 bases. The mRNA in the vaccine contains about 13% of the COVID-19 RNA genome. The mRNAs are synthesized in laboratories and are packaged in lipid nanoparticles to make the vaccines. After the mRNA vaccine injection, the mRNAs enter the human cells, which produce the COVID-19 spike proteins. The human immune system is stimulated by the spike proteins and generates specific antibodies that neutralize the COVID-19 virus to prevent infection. A second vaccine shot boosts the efficacy of the immunity against the COVID-19 to about 95%. I would like to clarify that mRNA vaccines do not contain the live coronavirus or cause COVID-19 infection, nor do they lead to human genetic mutation. Having said that, mRNA vaccination can cause some side effects. The side effects include local pain and/or swelling at the site of injection, fever, chills, headaches, muscle aches, fatigues, allergic reaction, and very rarely anaphylaxis, which is a very severe allergic reaction. Recently, it was also found that people may develop low platelet count after vaccination. This table from the CDC summarizes the percentage of people who had different adverse effects from COVID vaccines manufactured by both Moderna and Pfizer Biontech. Since the data was collected through January 14, 2021, it was too early to obtain the side effects information from the second dose of the Moderna vaccine, which was just approved on December 18, 2020. After the first injection, the percentage of people who had side effects was similar for both the Pfizer vaccine and the Moderna one. More people had side effects after the second Pfizer vaccine shot as compared to the first shot. This table illustrates the occurrences of anaphylaxis from mRNA vaccination. Anaphylaxis is a very rare but severe allergic reaction. Overall, there were 5 cases for every 1 million doses of Pfizer vaccine administered. For the Moderna vaccine, there were 2.8 cases for every 1 million doses. All of the patients who developed anaphylaxis have recovered. The Vaccine Adverse Event Report System, or VAERS, from the FDA and the CDC collected all the death information after the mRNA vaccination, regardless of the causes. The data from December 14, 2020 through February 7, 2021 showed 1,170 deaths with a mortality rate of 0.003%. Physicians from the CDC and the FDA have found no evidence to link these deaths to the COVID-19 vaccination. In addition, the School of Public Health at Brown University assessed the mortality rate after COVID-19 vaccination among residents at nursing home facilities at Genesis Healthcare. They found that the 7-day mortality rate was lower among vaccinated residents as compared to unvaccinated residents at the same facility. The mortality rate among the vaccinated residents was also lower than residents in facilities that have not started the vaccination. This study suggested that the COVID-19 vaccination does not appear to affect the short-term mortality among residents at nursing facilities. Furthermore, the investigation of the 23 deaths in Norway did not find any evidence that the COVID vaccines caused the death. So far, 50 million doses of mRNA vaccines have been administered in the United States. The vaccines are considered safe and effective in preventing COVID infection. I recommend that people get the vaccines as soon as possible to contain the COVID pandemic and to reduce viral mutations. Since COVID vaccination can cause side effects, and most eligible candidates for the COVID-19 vaccines at this time are older people with possible underlying medical conditions, I advise people to plan well before the vaccination so that you can get immediate medical assistance in case of serious adverse effects from the vaccines.